surprised that there is now this recent research that women actually need more sleep than men. Please hear it out, everybody.
I know.
Women need more sleep than men.
Hello, and welcome to episode number 7 of How Are You Really podcast. Let's talk wellness, the power of sleep for women. I am your host, Dr. Faryal Malik. I am a child, adolescent, and adult psychiatrist, and I am very pleased to introduce Dr. Sushrusha Arjyal. She is the owner and CEO of Bliss Sleep and Psychiatry in Morrisville, North Carolina. She is a board-certified psychiatrist and sleep specialist. Previously, she served as an assistant professor in the Department of Psychiatry at Duke University Hospital. She completed her residency at Berkshire Medical Center in Massachusetts and her fellowship at Wake Forest University in Winston-Salem, North Carolina. For several years, she has mentored residents, fellows, and international medical graduates. She also serves on several committees. Dr. Arjyal is the chair of the Race, Ethnicity and Equity Committee of the North Carolina Psychiatric Association. Additionally, she served as Vice President of the Health Foundation Nepal, a nonprofit organization dedicated to mental health care in Western Nepal. She lives in North Carolina with her family. In her free time, she enjoys hiking, kayaking, and swimming. Welcome, Dr. Arjyal.
Thank you so much, Dr. Malik. It's my pleasure to be here, and thank you for the kind introduction.
Thank you for being here. I'm really excited. I think that as psychiatrists, all of us have to know something about sleep psychiatry and treat it, but I think that this is great. I'm excited to learn more about what are the updates and then also what people need to know about sleep and why it's important. So I'm going to jump into the first question. What does it mean, sleep wellness?
So, sleep wellness is overall wellness. Sleep wellness is our physical wellness, our mental wellness, our overall well-being as a whole. And it also means better relationships, better job functionality, better earning, overall a better life.
So how is sleep wellness particularly crucial for women?
Dr. Malik, so there are so many differences in how the sleep functionality is different in men versus women, right? That is partly because of the hormonal changes in menstrual cycle every month. That is also because of pregnancy, postpartum, and a perimenopausal phase. So all of that has a huge effect on how the sleep is different in females versus males. The main difference that we can talk about is, and you'll be surprised that there is now this recent research that women actually need more sleep than men. Please hear it out, everybody. Women need more sleep than men.
So as soon as that study was published, one of my friends, she's a psychiatric nurse, she sent me the article and she was like, see, that's what I've been saying this entire time. Women need more sleep.
True, right? Partly not because we have the need, but because our sleep is overall disrupted. For various reasons, right? Like anxiety is more in females. There is more prevalence of depression in females. Our emotional health sort of suffers through the phases of life that we go through, and that can cause disrupted sleep. And not to mention the up and down of the hormone, the fluctuation, right?
Yeah, just through the menstrual period. Just like 3 days ago, I hadn't even started my period, but in my dream, I was having belly pain and cramps in my dream. And I woke up and I was like, I'm not even on my period. And literally my period started that day. So that was a very painful sleep.
Yeah, it is. And if you look at it like the premenstrual phase is the hardest in terms of sleep. It can cause insomnia, it can cause like overall body aches, pains, and there is really not one thing, just one thing. I wish there was just one thing that led to sleep disruption. There's not. In females, there's so many issues, and we haven't even talked about the child care and all of that yet, right?
Yeah. Yeah. Okay, so you said that even the disorders of sleep might be different in women than men. So can you tell me what are common sleep disorders in women?
Yeah, so overall, the sleep disorders are generally, even in men, tend to be underdiagnosed. Even something as common as obstructive sleep apnea, which can affect from like even 20 to 60, 70% of population, it's underdiagnosed in females and in males for that matter, but more so in females. But, I feel like even in my clinical practice, the sleep seems to be very underdiagnosed problem, except for insomnia. Because I'll give you an example, Dr. Malik. If two people, like male and female, they come for evaluation of obstructive sleep apnea, the male might say that I fall asleep every day.
Right away.
I'm sleepy. Sleepiness is one of the subjective symptoms. But in females, the subjective symptoms during the day might not be sleepiness. It might be, I'm irritable. I really can't finish my work. And if we look at something called Epworth Sleepiness Scale, 10 and above is considered sleepy. But in females, even if it's 9 or 8, if you have other symptoms, please go ahead and get that sleep study done. Because they might have sleep apnea. So, yes, I mean, obstructive sleep apnea is not more prevalent in females than in males, but there are other sleep disorders, to answer your question, more prevalent in females compared to males. And one of the main ones would be insomnia.
Okay. Okay. Yeah.
Insomnia for various reasons, again, right? Because of emotional burden, because of childcare burden, physical pain, autoimmune diseases, and all of that. And also, see, the overall prevalence of anxiety is more in females. And anxiety is the enemy of sleep. So anxiety can push your sleep away and especially cause sleep onset insomnia. So that is definitely more in females versus males. Also, if you look at restless leg syndrome, that is the urge to move your legs and keep moving, especially in the evening, it's worsened by caffeine. And there are a lot of other factors for restless legs. One of the main reasons why people have restless legs is low iron.
Yeah.
And that is very much like that can be something, a cause in like a female gender because of pregnancy, especially in pregnancy.
Yeah.
That, and nowadays there is a little bit of data on like if maybe narcolepsy is more prevalent in females as well.
Oh, really? I did not know that.
Yeah, so that's there, but definitely insomnia, all kinds of insomnia, sleep
Yeah.
onset, maintenance, waking up early in the morning.
Yeah. So can you explain what narcolepsy is?
Yeah, of course. So narcolepsy is one of the disorders of sleepiness. So people with narcolepsy are extremely sleepy during the day, meaning they would fall asleep in a heartbeat. And they also have other symptoms like they can suffer from something called sleep paralysis. So sleep paralysis is a phase where your mind is awake, but your body is paralyzed. And you'll be surprised, Dr. Malik. Like people do not forget sleep paralysis. It is so scary. People would say, "Oh, October 1983, one night I had suffered from," because it's very scary.
Yeah.
So they would say like, "I suffered from sleep paralysis then, but I never got diagnosed or treated for anything like that." And so narcolepsy is like type 1, type 2. There are two kinds of narcolepsy. That has to do with more like orexin receptors and all that. So I might not go into much technical details about why it happens. But what are the symptoms? The symptoms would be excessive sleepiness during the day, would be sleep paralysis. They would be hallucinating. And by hallucinations, I don't mean like the hallucinations of psychosis or psychiatric disorders during the day. But people with narcolepsy, how they describe it is, I'm awake, but I'm still dreaming. But I'm almost about to go to bed, but I feel like I'm already in my dream sleep.
Yeah.
But these are not the people who otherwise would be hearing voices or seeing things. So that's the difference. But this definitely needs a specialist, and a specialist need to be consulting and then doing sleep study and then going for the treatment. So it's a big deal for sure.
Yeah. Yeah. And also, how do you differentiate, like, because most people, when they have sleep issues, they just think that they have insomnia, but a lot of the times it turns out that they have sleep apnea. So what is the difference between the two?
So in sleep apnea, generally people have snoring. So they snore, they would have history like I wake up gasping for breath. Or the other history can be I have no problems going to sleep, but I wake up in the middle of the night. And especially in the middle of the night or at 3, 4 a.m. Or the history can be I wake up multiple times at night. I can go back to sleep, but I feel extremely tired during the day. I don't feel rested. Other very typical history can be, hey, Dr. Arjyal, I have no problems going to sleep or staying asleep, but I'm so tired during the day. I feel like I have not slept at all. So that can be one of the history too. So the difference between just pure insomnia and someone who has obstructive sleep apnea is snoring, waking up gasping for breath. Higher BMI can definitely indicate towards the likelihood of having obstructive sleep apnea, but there is no guarantee. People with even the perfect BMI, if they are snoring and have other symptoms, should be concerned about obstructive sleep apnea. Pure insomnia would look like this most of the times, right? I have no other symptoms. I can have other symptoms, but I cannot fall asleep. And I'm super anxious, and I've been this way for a very long time, and I'm tired and irritable, but I'm not sleepy during the day.
Okay, so I know that we talked a little bit about hormonal changes and pregnancy and how sleep patterns continue to get different with different phases of life. When do you think is probably the worst time a woman will have experienced the worst sleep, or is it just dependent just on the person? And what can people do in different phases to help with their sleep?
Yeah, see, the premenstrual phase is hard, right? Hormonally too. That's where the sleep disruption occurs the most. If we talk about pregnancy, the first trimester is hard, again, because of the hormonal changes and everything. The second trimester seems to be a little better than first in terms of sleep. That's what the data has shown. The third trimester, again, is very much into, because of the weight of the fetus, because of the urinary problems. There are so many things that, goes into the pregnancy. And so that can be hard as well. So as to what to do, first of all, educating people that this is going to happen is very important. Treating chronic pain that might arise because of back pain and all that, it's important as much as the pregnancy allows, and as much we have to, again, this is a very tricky situation because we have to find medications that is not harmful to the fetus. So there is very little you can do during the pregnancy itself for the mom. So we have to be careful about that. The third would be to create a good structure, good sleep hygiene, and avoiding caffeine, of course. Those kind of things would be very important. Regular exercise for about 30 minutes at least, that is important. And one of the other most important things, Dr. Malik, would be to see if they are snoring and they have symptoms of obstructive sleep apnea that might worsen in pregnancy, which can further lead to the fatigue within an already fatigued mom.
Yeah.
And so that needs to be diagnosed and treated.
Since you said diagnosed and treated obstructive sleep apnea, from my understanding, the treatment is wearing the CPAP overnight, and people don't like wearing it and end up not wearing it. Is there a different treatment route that they can go?
Yeah, see, I'm glad you asked that question, right? I'm really glad. Because when people think about CPAP, they think this, right? So CPAP is not always a full face mask. CPAP can be a nasal mask, a nasal pillow, something that looks like oxygen cannula, as simple as that. So you don't have to have something on the face always, over your overall face. So that is something to be kept in mind. There are other alternative treatments like dental appliance. There is a treatment called hypoglossal nerve stimulation therapy that we coordinate with the surgeons to help people with obstructive sleep apnea. There are certain protocols to that, of course, like everything else, right? But there are treatment options. And now there are new weight loss medications. The weight loss medication that can be also used for people with obstructive sleep apnea. So there are options, yes. But my clinical take on it, and this comes purely from my experience, is if you have never tried CPAP, it's worth giving it a try. The reason being is it's very non-invasive, and usually I've found that people have more fear of CPAP than when they actually use it. It kind of is like, okay, Dr. Arjyal, it wasn't that bad. So yeah, that would be my recommendation for sure.
Okay, that makes sense. What about insomnia? What are you telling your patients? Like, how are you treating it? Are you giving them just like different things to try and, just non-medication, or are you giving them medication? What are you giving them? Like, tell me about that.
So first of all, and I used to tell my residents, and my fellows that we have to know the patient as a whole. Because insomnia is such a frequently used diagnosis, and people can have so many different meanings. What do you mean when you have insomnia? So, what does this mean to you? Right? That is the most important thing. And I try to sort it out as a psychiatrist also. Does it mean patient had history of trauma and is waking up with nightmares? Does it mean that patient has severe anxiety during the day that has not been treated and that's causing the sleep disruption? So what does it mean? First of all, kind of finding that out. And then the treatment basically depends on that.
Yeah.
So suppose if we have ruled out everything, right?
Yeah.
If we have ruled out that, okay, patient doesn't have sleep apnea, doesn't have any psychiatric disorders, nothing, and it's pure sleep onset insomnia, then cognitive behavioral therapy for insomnia is the best treatment, meaning medication is not the first line of treatment for chronic insomnia. Actually, it can, in the long term, do more harm than good. But having said that, do I have patients who are on medications for chronic insomnia? Yes. The reason being that it's very hard to get off those medications. So we have to have a process. So I do work with patients in helping them come off of those medications too. The hypnotics, the sedatives, the benzodiazepines. So it's worth trying to taper it off if you have been on it for so long. But that has to be done with the help of a physician, and then connecting them to people who do cognitive behavioral therapy of insomnia. That is very important for pure sleep onset chronic insomnia.
Okay. Yeah. So you said that medication can do more harm than good. Can you kind of go into that a little bit? Because I think people don't understand that part. Hello. This podcast is being sponsored by FMP Mental Health Spa and Family Psychiatry. If you need help, please reach out to us via our website or email or call us. We are available in Tampa, Florida in person, as well as via telepsychiatry in the states of Florida, Georgia, Kentucky, Virginia, and now Pennsylvania as well.
So first of all, because it is an education session also, right? An educational video. One thing that I'd like to ask people not to do is please do not go right on medications. Do not take supplements that you don't know what is in there. Really, because sleep and sleep disorders, it is a whole specialty, really, and it's worth talking to a doctor first to find out what's going on. On that note, I'll just add an example, okay? Without mentioning any details, I have had some patients who were drinking excessive caffeine. And all we had to do was kind of sit down and say, you cannot drink this much caffeine. This is the half-life of caffeine, and this is how the caffeine affects. So something as simple as that, and it does not need intervention with medications at least. So just I kind of digressed from the actual question, but the side effects of hypnotics and sedatives they can have adverse effect in your memory, right? They can cause falls. They are huge fall risk. And overall, most of them don't improve the quality of your sleep.
Yeah.
And what they do is they reduce the sleep latency, meaning the time that you can fall asleep. And that also is very temporary. Once you get used to it, and then you get used to it.
Okay.
They stop working. And the most dangerous thing is like medications like benzodiazepines. If you have been on it for a long period of time, stopping it abruptly can cause seizures.
Yes.
So you do not want to even stop that abruptly without the help of a doctor.
Yeah.
Absolutely. See a physician, then kind of spend good time in a proper history. And then the management will follow for.
Yeah. Yeah.
for the
Okay.
individual patient.
Right, yeah. So you said something about don't take supplements. There's so much going on with the supplements right now. It's out of control a little bit. So I'm glad that you brought that up. So my question is then, I was reading something about magnesium helping with sleep, and people are telling their patients to take it. And I guess some companies are pushing it too and all of that. But I take my magnesium in the morning. I've always taken it in the morning. It does not make me sleepy. And I
Okay.
went ahead and actually ordered the brand that they were recommending of the magnesium. And yeah, it didn't make any difference to me. I wanted to try it to see if I took it in the morning. Nothing happened. So I was like, okay, well, this is not going to work. So, how can we help our patients understand this exact thing, right? Like the supplement, that it is not gonna work like magic, or how can they figure out that if this supplement is actually the right supplement for them? They're being told so many things from so many different people that they're confused.
Yeah, see, one of the things is supplements can be taken, but it has to be approved by someone who has been in that field. What I generally do is, if someone has been taking it for a certain period of time and says, oh, it is helping me, I don't say, okay, stop outright. But what I ask them is, I ask them to bring the bottle and I look at it and see what is in that. So, what is in the supplement? So, it could be anything, like if it is their melatonin, because there are some supplements with melatonin.
Yeah, yeah, absolutely.
And how much melatonin is it, or what else is there? And Dr. Malik, actually, honestly, if I don't know about certain ingredients, I tell them, see, this is something that I have never heard of.
So many new things all the time, right?
Yeah.
All the time.
And if I can't find any kind of robust data on that, I tell my patients, I have never heard of this. And I know it probably is helping you, but I would be cautious. And until you find an expert in this particular brand, it's okay to be cautious. And we have to be really careful of, do I want to add more medications to that?
Yeah, absolutely. Yeah, that's
That it makes me a little cautious about, like, what is the quantity, and if you don't have the data, because anything in a quantity that is not approved or recommended or tested can be dangerous,
yeah,
right?
absolutely. Yeah, so coming back to women,
Yeah.
and supplements. The new thing is perimenopause. Every single woman from 30s to, I don't know, 55 is in perimenopause now. So what do you say about that? What's your opinion? What are you seeing? And when does actually perimenopause start? And when does it start affecting sleep or anything like that?
It's not just the, like you said, the age, probably the age bar is different, right? But my take has always been the individual, really. Because the reason why is the hormonal changes occur like throughout our
Right.
lives,
Exactly.
right?
Yes.
And age is honestly just a number, because people can be at so many different stages at the same age. If you look at three individuals, depending on the nutrition, depending on the exercise, depending on the stressors in life, depending on so many other things, right?
Yeah.
Untreated other things. So that probably won't be like a really good measure of like what should we do when we're 30. But
Yeah.
I can tell you a little bit about what can we do in terms of like to help, you know, overall for our overall mental, physical health and sleep.
Yeah.
So something to remember. And on that note, I'll take the liberty to explain the effect of alcohol also.
Yeah, yeah. No, so this is, thank you for saying that. One, it's like person to person, and two, we are going through hormonal changes every single month, year, right? So there's no clear cut, okay, now we're in perimenopause and now this, it's like a whole process, right?
Yes. And so even like, let's say if we take like few people at the age of 35, right? Depending on how many children they have had, how many people have gone through miscarriages, people have gone through so much that we don't even know.
Yeah,
So that
absolutely.
definitely causes the emotional burden that causes, and then the childcare burden if people have many
Absolutely.
kids. So that is very individual, and from one person to the other, it varies. But overall, what we can do is, if possible, that also I say with a lot of respect and a lot of understanding that it might not always be possible, but definitely a healthy diet. right?
Yeah.
Exercise, time for self-care
Yep.
is so important. 30, 40, 50 minutes. And I don't mean to say that
Yeah.
people
Yeah.
don't
No.
focus on that. Sometimes they might, but if you're picking up three kids from three different
Yep.
places and the extracurricular activities, you might not have time for yourself. I do understand that. And like I said, like with a lot of respect, I say this, but it definitely helps.
Yep. Yep.
Having that, again, the downtime to sleep. So I call it preparing for sleep,
Mm-hmm.
taking the electronics away for about an hour before bedtime
Mm-hmm.
with the dim light, reading that good old book, not the electronics, like the paper book. I usually do that. I cannot say I always do that because I don't want to say, oh, I'm all there. But when I do that, even the feel of the book and the smell of the book, it makes me feel better, makes my mood better.
Mm-hmm.
So reading, if you're really not interested, and people might not be interested, they might be like, oh, I'm too exhausted.
Mm-hmm.
Then rather than looking at the electronics, maybe listening to audiobooks, good music,
Mm-hmm.
and preparing for the bed before you actually go to bed. And please do not do all of these activities in the bed. Do it somewhere else, maybe in a little sofa, chair, on the floor, wherever.
Mm-hmm.
And then when you're drowsy, please go to bed.
Yeah.
And that will help you sleep without much other intervention.
Absolutely. So I have tried this where I've told people to put their electronics away, and it's very hard for them to do that because maybe that's just yeah, even my family members, like my older sister, that's when she finally gets time to actually check anything going on. And so what I usually tell them is to like dim it all the way down and the blue light filter all the way up. So my own screen actually at 8 p.m. turns completely orange. There's just no color. I'm out with friends. They'll try to take a picture, grab my phone, and they're like, "What is going on with your screen?" I'm like, "Don't worry about it. It's gonna take your normal picture." I was saying that like I'll tell them to turn their like blue filter all the way up and dim it all the way down so that even if that's the time they're catching up with messages or doing whatever, then, I do it. So I'm just like, I can't really preach what I can't practice myself because it's just, we're in this practical world of technology now, right? What is your take on it? Since you're the sleep psychiatrist, so you tell me.
I
Yeah.
try. And
Mhm.
what I can say is from personal experience, it does definitely helps your sleep if we can do that. And what we could do is as a practical solution, like maybe have a little bin and keep it outside our bedroom and drop the phone there. And go to bed in a very ideal situation, right? And I'm not saying some people are on call, they're working remotely, so they have to answer the calls. But in cases that is possible, we could do that. No TV in the bedroom. Please, no TV in the bedroom. These days,
I
I
don't have
see
one.
in households there are multiple TVs and one is in the bedroom. We do not need that because it's not work related, also.
Yeah.
Right? That will help. And having that small space, in your bedroom, small space, it doesn't have to be big, fancy, nothing, where you can sit and do other things. Some people like crocheting. People like so many other things that is not related to like electronics. If people could do that just for even 10, 15 minutes before bedtime, it helps your focus, your memory, improves your sleep. And see, Dr. Malik, I grew up in a world where I remember, when I was in medical school, we had that dial phone. We didn't even have the cell phones and all that. So it hasn't been very long that we have gotten used to all these electronics.
Mm-hmm. Yeah.
We had a structure prior to the cell phones also, and we did
Absolutely.
communicate.
Absolutely.
So I understand it is hard, and it is hard for me too, you
Yeah.
know but it is more about forming that habit and small steps every day and the discipline, right?
Mm-hmm. Mm-hmm. Okay, yeah. What about the younger generation? So younger generation of upcoming women because our Gen Zs are now in their 20s, right? They they have pretty much grown up with electronics, and for them their phone is their entire life. All their friends live in there and everything is working with electronics, right? So what is your advice to people like those young kids that are just grown up with electronics and now so much distraction and the sleep is poor for everyone. And then that results in all the mood issues and everything that you were talking about earlier.
True.
So what do you advise them? How should I word it to my patients so that they will grasp it better?
Yeah, so I think we can start with the education and importance of good sleep.
Mm-hmm.
If people get good sleep, they have better memory,
Mm-hmm.
they live longer,
Mm-hmm. Mm-hmm.
they have less effect on their heart, their cardiovascular system is better, their memory in the sense of procedural memories are better,
Mm-hmm.
their overall immune system is better,
Mm-hmm.
meaning they get sick less often, their relationships are better. So sleep in some ways is a key to a lot of other functionalities in our life.
Mm-hmm.
So anybody who invests in good sleep is going to invest in their future, is going to invest in their relationships,
Mm-hmm.
is going to perhaps invest in better education, better
Yeah.
course,
Mm-hmm.
better job market.
Yeah.
Perhaps a bit of an exaggeration here, it feels like. But when you're saying, how do I talk to my patient about this? Telling them about these things might not be very far from reality, really. Because if someone is using electronics many hours of the day, we know that they have problems with focus.
Mm-hmm.
We know that they are more anxious. We know those things now. They
Mm-hmm.
have increased even symptoms of ADHD.
Yeah.
We know that people heal better from trauma if they sleep better,
Yep.
right? So I guess we'd start with the education first.
Mm-hmm.
And in terms of lifestyle changes, if we ask them not to use electronics at all and say we lived in the era of no electronics and you should start writing letters, it's
Mm-hmm.
not gonna go very
Yeah.
well,
Yeah.
you know.
Yeah.
But maybe like small steps, like instead of making internet friends, can we make real friends?
Mm-hmm.
You know, maybe half an hour a day. Can we socialize?
Mm-hmm.
It is going to be huge, but starting one patient at a time.
Right.
And really, and with, teenagers and people, I do see teenagers as well for sleep disorders.
Yeah.
So
Yeah.
we can start with, what hobbies do you have? What
Mm-hmm.
do you do when you're not using your phone? And when
Mm-hmm.
you're not in school? And how many friends do you have outside the virtual world?
Mm-hmm.
And what do you do with them? What kind of
Yeah.
activities?
Yeah.
So building that and absolutely involving the parents.
Yeah. Okay. So we've talked so much bad stuff about the technology, but I'm sure that there's good uses, right? Can technology be used in a positive way to help with sleep?
One of the things that I can think is, if someone is suffering from severe insomnia and we're treating, perhaps like in that specific time, recording their sleep, in a way, tracking their sleep might be a validating point there, stating that, okay, this medication or this therapy is working
Mm-hmm.
or not working, and this is what we need to improve. That's where I see technology is helpful.
Yeah. What about recommending any apps or anything like that that would help in, I guess, falling asleep or recording sleep, or do you have any recommendations, or are you like, okay, no, put your phone away. It should be completely out.
Yeah, I mean, I think as new apps develop, and like, I mean, you will find different opinions on this from different sleep specialists. Personally, I'm someone who would say, please keep the phone away. Please keep the phone away. Maybe if you need, like, white noise might not be a bad thing. Overall, I ask people not to track their sleep.
No, that's like great advice. So I've been told that wearing your smartwatch, or now they're like those smart rings and stuff that monitors, and it
Yes.
brings out your sleep patterns, right? How much time you're have deep sleep versus light sleep, and just to simplify it, right? Your different phases of sleep, it'll kind of tell you. Do you think that that's beneficial, or do you think that that's like too much information? That's what I'm hearing, too much information.
Yeah, see, I'm a psychiatrist as well, right? So I'd avoid anything that causes more anxiety.
Yeah.
And also I'm kind of cautious. Again, you will find people with different opinions here, right? But what I think is, if we are not offering solutions parallelly, then it's not. So why are we tracking? Like, it's almost like when we do labs. Why do we do labs? Because I know that the patient is going to come back to me and I know what to do.
Right. Yeah.
with the lab values. But if we ask people to just track it and we don't offer solution, then what next, right? What are the chances that the patient who has disrupted sleep won't get anxious about their sleep and won't cause insomnia further, right? So it's a perpetuating thing, especially for insomnia. I ask people not to track, at least my patients. If we are going through cognitive behavioral therapy for insomnia, and if you're psychologist, or sometimes when I do CBT, I will ask you to track it for 2 weeks, but then after 2 weeks, I'll give you a solution. So that, I think that is very important to think about solution parallelly.
Yeah, absolutely. That's some really smart advice because I have a lot of issues with sleep. So this is a great topic for me. I was told to wear my watch and I will wear it like every now and again just to see, okay, am I getting enough like deep sleep or not? Even when I feel rested and I wake up, it says that I didn't get enough deep sleep, but I feel rested. I hate having anything on me. I like taking everything off and I go to bed. It's annoying to me. I take off my rings. Also, smartwatches aren't that smart when you're asleep and you don't completely turn it into a do not disturb. Your phone can be silent, but your watch will still start vibrating if somebody's calling.
Yeah.
So,
So there is the answer, right?
right.
See, the accuracy, I'm not going to get into like which is better and not, right?
Dr. Arjyal is the owner of Bliss Sleep and Psychiatry, and she's treating patients with sleep and psychiatric disorders. She's also doing sleep studies. She is currently accepting new patients.
In the in-lab study, we have the EEGs, and then we get an opportunity to monitor it.
Yeah.
The technician monitors it, we monitor it, it goes through a board-certified sleep specialist, we sign it, so we know what stages are there. And that is also something we can't say, oh, this is going to be 100% the next night's sleep as well, because it varies night to night. So that makes me a little cautious because generally, for example, if someone knows that they are not sleeping and they don't have deep sleep, they should see a doctor, a sleep specialist, and then tease apart what's going on.
Sleep study is basically going to more so focus on ruling out sleep apnea, correct?
If we look at the spectrum of sleep disorders, sleep apnea is one of them, and there are others like parasomnia, in which people, sleepwalk, people get up and eat in their sleep and not remember. Disorders like REM behavior disorders, which are dream enactment behaviors when people are actually acting out in their dreams, meaning if they're fishing, they're swinging their arms. If they're chasing a tiger, they're actually falling out of bed. In all of the above, and we talked about narcolepsy, in all of these sleep disorders, we do need a sleep study.
Right.
Yeah. And sleep study helps us, rule out or diagnose all of them. Because, Dr. Malik, in my years of practice, I have seen so many things. Like sometimes people get referred to me just for sleep study. And I would sit down and talk to the patient. And there are so many things that is just not sleep.
Yeah.
That comes up like anxiety, bereavement, unprocessed trauma, grief, you name it, and all of the above is affecting the sleep.
Right. Yeah.
Sometimes substance use that we haven't talked about. And again, chronic pain. So it's very important other than just tracking, which I don't find it's very helpful.
I want to bring it back to women. So women that have like babies, young children, they're waking up throughout the night, right? They're light sleepers because just naturally, I think that must be hormones too, right? That like naturally the hormones is my baby okay, right? So they're light sleepers. What do you recommend for them? How can they improve their sleep? What is your recommendation in that case? Because that's almost an impossible situation to me. I don't have kids, so I don't know yet, but it sounds impossible.
Yeah, it is because, so why is it hard? It is hard not just because of the biology of what happens, right? It is hard because of the childcare burden also. We should talk about that. Because see, even in developed countries, more than 50% of the childcare burden is on females. In developing countries, it's more than 70%. I was giving a talk on International Women's Day on this and the data, and we haven't even counted the unpaid labor the household work, the cooking and the cleaning and everything else. So yeah, physiology we're not going to change, right? It is what it is. And the changes during pregnancy, we're not going to change that. It is what it is. But we can make it better by giving the mother a little bit of break, setting up a good structure so that the mom gets some help, gets to nap a little bit. There are a couple of medications, though, and I probably won't name here, but there are a couple of medications which are safe in pregnancy. They can be prescribed. If someone is getting treatment for mental health, then it has to be intensified, be it with like more regular appointments with your therapist, increment in medications, reducing medications, increasing therapy, and then sharing that burden with the new mom is going to help so that they get some time to exercise, they get time to eat healthy. And we both know postpartum blues are there, postpartum depression, in rare cases, it's low incidence, but postpartum psychosis is there. So I don't think it is just about what the mom should do for a good sleep, but what the family can do so that the mom can sleep better.
Yeah.
Overall. So can someone give her a break, please? That would be important. And rest of the recommendations, they are the same for males and females, right? Getting up in the morning, not taking daytime naps if possible. If you're suffering from nighttime insomnia, consolidating the sleep at night. But for new moms, this might be hard because the only time they might get to sleep is when the baby is sleeping.
Yeah.
So yeah, but it is possible, it is manageable, and it's a phase that is temporary, right?
Right. So I know you've mentioned CBTI a few times. There's very few specialists that actually do it and do it right, right? I mean, I know CBT, I can just say, oh, I can do CBTI. I don't know. I don't know what CBTI involves, right? It's a very subspecialized type of CBT, which is cognitive behavioral therapy, just for people that don't know, right? And CBT for insomnia is a subspecialty of it. And I did not receive training in it, and I don't think a lot of people do. So if I don't have access to the one psychologist that's great here in Tampa, they have a wait list for like 3 months. What do I do? Meanwhile, how can I access CBTI? Like, are there books that I can use on my own, like workbooks, or are there like YouTube programs or something? How can I get that?
That's a great question. So CBTI has different modules. I want to say there are apps for CBTI that you could use, purchase and use. It's a very tricky question because trying to do CBTI on your own is trying to do your own therapy. Which can be counterproductive.
Right.
But when you compare to like your scenario of like a CBTI specialist is 8 months down the road, what do I do?
Yeah.
The best bet would be to try the apps, but not expect that it would work 100% like a in-person therapy would. And even if the CBTI specialist is not available, maybe like just checking in with your primary care physician to see what can be done in the meantime, because not all sleep medications are habit forming and not all sleep medications make you dependent on them.
Right.
Could you try that? Is there any other, change that you could do? But to answer your question, yeah, there are a couple of CBTI apps that you can purchase and you can use. But clinically, I haven't had a lot of response to that.
Okay.
People have bought and people have been, oh, yeah, I did, but I couldn't. And sleep
Yeah.
hygiene is one of the modules, but sleep hygiene is not the only thing.
Right.
A lot of people already know that they shouldn't drink caffeine, they shouldn't drink alcohol. They know that,
Okay. Now, melatonin, that's a very simple thing. Everybody's getting a sleepy time tea and whatever. A lot of these things have melatonin. What is your opinion about melatonin? How much melatonin should people take if they are taking it? And what time should they take it? There's a bunch of things that are around melatonin that I want to hear from you.
Yeah, so melatonin is unregulated, right? In the sense the melatonin content in different melatonin can be different. And it varies by a huge percentage. So my first advice would be melatonin is not the go-to medication for chronic insomnia. So it's not recommended that you take melatonin for years and years. But is melatonin helpful? To some extent it is. You should take it like 45 minutes before bedtime, intended bedtime, up to 10 milligrams. And one of the most important things about melatonin is if you're taking one brand of melatonin of 3 milligrams, if you're increasing the dose, please make sure it's the same brand. Because otherwise the content would be different. So that's something that I would advise. But instead of Dr. Malik, like melatonin is a helpful medication for dream enactment behavior.
Okay.
It can be used in that. Small dose of melatonin can be used in something what we call circadian rhythm disorder.
Mm-hmm.
When people get good number of hours of sleep, but they are sleeping either too early or too late.
Mm-hmm.
So depending on like advanced phase or delayed phase and that
Yeah.
kind of thing. You know,
And that's a small dose.
it's a small dose. And that has to be timed a few hours before their bedtime so that it either pulls the sleep or pushes the sleep away. So this for circadian rhythm has to be done with the help of by a physician. But general public, what they can do is sometimes it's very difficult to do small things that we like simple things, right? So they can focus on those. If they do it regularly for weeks and months, the sleep will improve to some extent.
Absolutely. So, do you, in your practice, have you seen something that is really surprising or really surprised you about sleep issues in women as opposed to men?
Yeah, I am surprised, and I continue to be surprised about how many people live with trauma, untreated trauma, unprocessed grief, and domestic violence. I wrote an article about the domestic violence in CPA, North Carolina Psychiatric Association, the newsletter. That continues to surprise me, and it takes time to get that history. What exactly happened? Why are you not sleeping? I have had patients who have not talked for like many sessions to someone who revealed, people who would reveal that, yeah, because of that, I'm sleeping with a loaded gun, under my pillow. Then we come, with to the conclusion, like, no wonder you're not sleeping. So that continues to surprise me. The power of physician patient alliance still continues to surprise me, how effective it is. And it can be so healing, really, even without adding more medications, without doing anything, just the therapy part of it.
Yeah. Hello, everyone. I just wanted to stop by and ask you, how are you really doing? Also, how are we doing? Are you guys enjoying this topic? Please leave us comments about it. And also, if you have any pressing questions, please go ahead and leave those in the comments too. We will find an expert to come and speak about it. Finally, please subscribe to the channel, like our videos, share it with your friends, and follow us on Instagram. So, what made you interested in the whole sleep thing? Because psychiatry, there's so much you could have chosen to do. What made you more interested in sleep? Is there a personal story behind it?
Not a personal story, but probably is not as interesting. But I did see a lot of overlap in patients with sleep apnea, depression, patients with narcolepsy and depression, patients with trauma and insomnia, restless legs and anxiety. So I decided to do sleep fellowship because of that. And also one other thing is I really love reading sleep studies.
Yeah.
No, I do. I like those squiggly lines and the EEGs, and it's very fun. And then you sit down and read with your fellow or your resident or whoever the technician who is going through this. And it's fun to get that. Oh, do you think it's REM behavior disorder? What do you think? And that kind of thing. So I really find it interesting, and the whole embedding that in clinical care.
Yeah. Yeah. Okay. So, lastly, how about your sleep? How's your sleep? I already told that my sleep is just all over the place.
Can I be really honest with you?
Yeah.
My sleep, I walk about 2 to 3 miles a day, every
Okay.
day. I love swimming. So my sleep is really different on the days that I don't walk versus the days, because no, I try to do it, but there are some days where I'm just not able to. And my sleep is so different, so different. And my mood is different. And depending on how I sleep, the next day is different.
Yeah, yeah, absolutely. Yeah.
So it just matters. I wasn't so focused on exercise
Yeah.
during my residency. But now I am. Now I'm like, no matter what happens, I'm going to turn the computer off and go and walk. Because I know I'm going to be cranky at night otherwise.
Yeah. That's like incredible, right? How
Yeah.
much that helps just walking and everything.
Yeah, no, absolutely. And also, it took me, so I don't want to say that it is not true that I got into 2 miles, 3 miles a day. No, I started very slowly.
Yeah.
And then I built the habit and all that, and I reduced my caffeine intake significantly because you know how residency is, right?
Yeah.
You survive on caffeine, you get through.
Yep.
But then
Yep.
those kind of lifestyle changes has helped my sleep quite a bit. But
Yeah.
I also do realize that sleep is a very dynamic thing, right? It's
Mm-hmm.
not going to stay the same every day, every night for the
Yeah.
next I don't know how many years, right?
Yeah.
So it's
Yeah.
going to change, and I have to change according to that.
Right.
So that means early dinner, that means walk after dinner. So all incorporating those small changes.
Yeah, that's incredible. Okay, so lastly, I always ask this question, how are you really doing?
Doing great.
That's great.
No, I am actually doing great. I feel very blessed
Mhm.
to be a physician, and I mean it. I feel, I don't think, I could have been doing anything else if I would.
Yeah.
Or maybe I would, I don't know. But I really like my patient interaction, being one-to-one with the patient. I started a new practice. I'm getting to learn so many different things.
Mhm.
And on a fun note, I'm learning to play sitar.
Wow, that's amazing. You know, I got tablas and I still have not started taking classes. I really want to do that.
Yeah, I'm taking classes once a week.
That's
So I'm
incredible.
learning to play like saregama now.
That's awesome. So
Yeah, so I'm learning
fun.
that. I'm learning to cook new dishes in my free
Yeah.
time. So I'm exploring with that, a little bit of gardening.
Mhm.
I love hiking. I love North Carolina. Florida is nice, but I love North Carolina.
Yeah.
So I love being with
Beautiful.
nature. I think
Mhm.
that's very important. I really de-stress when I am
Mhm.
with nature.
Yeah.
It can be walk, swimming, it can be other activities, reading in the sun.
Yeah, yeah, absolutely. Now I'm motivated. I'm gonna go get my tabla lessons and maybe next session you and I can have our like little musical. I need to learn the tabla before I start getting arthritis.
Please do, because it'll be so much fun once we start. Now I'm just starting. I've started playing saregama only.
Yeah, yeah.
So I'm prepared. Like it might take me 5 years to properly
Yeah,
play sitar,
absolutely.
which I'm
Absolutely.
okay with. But that's where I'm at. But
Yeah.
good luck with tabla. I'd love to hear more.
Yeah, I know. Thank you so much for doing this with me. Thank you for taking out the time to talk to us about sleep and the power of sleep in women. This was really great. I appreciate your time.
Thank you so much, and it was such a pleasure talking to you.
Likewise.
You have I think the aura that you put people at ease. It was a very, very nice experience for me. Thank you so
Yeah,
much.
of
Okay.
course. Yeah, no, and I hope like everyone in our listeners and audience will learn something today and take care of themselves and take care of their sleep. I want to thank everyone that's tuning in. Subscribe to the channel, share it with people so other people can learn about sleep. And thank you so much. Until next time.